It's one of the country's most diverse and poorest areas, but the Primary Care Trust sees that as a challenge, not a problem. This is Birmingham East and North, BEN, the short, BEN, where the bill for healthcare is being helped, not hindered, by innovation.
We have a population that is dying up to 10 years earlier than they would be if they were in other parts of the country. And so we set out as our core purpose working in partnership to tackle health inequalities and to improve health and well-being.
Whatever their age, whatever their background, whatever their need, the emphasis is on working with patients as well as a whole host of professionals.
So it's almost PCT could also stand for people coming together, couldn't it?
It could, and I hadn't thought of that one before.
And coming together under one roof, you'll find the nation's first and only Partners in Health Centre, a place where patients with long-term conditions can get specialist treatment and learn how to care for themselves. On this day, we saw a back pain clinic, a cardiac rehabilitation programme, an orthopaedic assessment, and a COPD clinic.
Keep going, keep going, keep going.
And I could keep going. The list of treatments and clinics in this one location goes on and on.
Keep going, keep going, keep going. You can stop there.
To empower the patient, if you give them the education they need, and also do that amongst people providing care, you're going to have enormous health benefits, but huge health economic benefits.
July 2005 we opened here, and it's the only centre like it in the country.
We've actually managed to assess and treat about 70% of patients within primary care. Mr. Lee, please.
Another busy day at the Urgent Care Centre.
I've just got a small puncture wound to my right hand.
Instead of travelling to accident and emergency, walking wounded in North Birmingham can come here for treatment. Jerry Peake's initials may be GP, but there are no doctors in the house. His quick local service is nurse-led.
They are all extended nurse prescribers, which means once we've assessed the patient, we can treat them. We can write a prescription for the treatment that they require.
At Yardley Green Medical Centre, there are, of course, GPs, and some of them have specialist knowledge. The Sexual Health Service is doing a lot to remove the secrecy and stigma surrounding the issue.
If you can get pregnant, you can get an STI. So sperms and germs are locked together, and encouraging the clinical staff to approach it on that basis.
From sex to marriage. The marriage of clinicians and managers. This GP is also chair of the Professional Executive Committee. In Birmingham East and North, they like doctors to be involved in policy decisions.
All clinicians, in my view, want to provide the best service for their patients, and I think all managers want to provide best health for the population. It's marrying those two goals together in a most effective way that's part of my role.
Working hard in the second city, a primary care trust that's second to none.
Problems there?